Hi, everyone. Want to welcome you to today's DHEC January 11th DHEC media briefing on COVID-19 in South Carolina, again featuring Dr. Brandon Traxler, DHEC Interim Public Health Director, and Stephen White, our DHEC Immunizations Director. We'd like to thank our media partners for joining us today and for helping us to spread the word far and wide on the latest information on COVID-19 vaccine in our state. Dr. Traxler is going to provide an update, then we'll move into facilitated question and answers. And if there's time, we will also move into a live Q&A, and I'll call on folks as hands are raised. So without further ado, Dr. Traxler, please provide today's update.
Thanks, Christy, and thank you. Good afternoon, everyone. Thanks for joining us. While we have new information to provide today, I plan to try to make these opening remarks fairly brief so that we can continue to answer as many of the questions as possible during the time we have. We're continuing to make great strides in vaccinations and those efforts in South Carolina and across the country. Each day, more and more vaccines are being administered into the arms of South Carolinians. More than 105,800 doses of COVID-19 vaccines have been administered in our state as of this morning. In our efforts to further expedite the rate at which the vaccine becomes more widely available to all South Carolinians, today DHEC and the governor's office announced that all South Carolinians who are age 70 and older, regardless of their health status or presence or lack of any pre-existing conditions, can begin scheduling appointments this Wednesday, January 13th, to begin to schedule those appointments for their COVID-19 vaccine. This is an extraordinary announcement because those age 70 and older have been the most devastated by this disease in our state. As noted in our news release today, the mortality rate from COVID-19 for those 70 and older is approximately 655 deaths per 100,000 individuals. And then you compare that to those under the age of 70, there are only approximately 37 COVID-19 deaths per 100,000 individuals. That is a very staggering comparison and illustrates why vaccinating those 70 and older is a critical next step in our mission to save lives. More than 67%, 2/3 of COVID-19 deaths in South Carolina have been among those aged 70 years and older. We estimate that there are roughly 627,800 South Carolinians who are age 70 or older in South Carolina. Although it is important to recognize that many of those residents have already received their vaccine, either through the long-term care federal pharmacy vaccine program that's underway, or for some, they're frontline medical workers who were eligible for the vaccine that way. Launched today was a new online tool that provides a resource for locating a facility where those 70 and older can make an appointment to receive their vaccine. We will continue to work to have more and more locations offering vaccine, especially in those rural and underserved communities who may not have a healthcare facility or hospital nearby. Mobile clinics will be an essential part of our plans to bring vaccine to the people. We understand that some of our elderly populations aren't comfortable with navigating websites or sending emails, and that's why anyone can also call our care line, and our care line staff can assist with providing the correct contact information for scheduling an appointment. DHEC's care line number is 1-855-472-3432. It is important to remember that both vaccines currently available require 2 shots, and it's important for everyone to receive both of those shots. Both the Pfizer-BioNTech and the Moderna vaccines are 94 to 95% effective in preventing disease, but that's only after both shots are administered. Individuals will receive a vaccine card after receiving their first shot, reminding them of when their second shot is due. Many providers are also issuing second dose appointment reminders to patients by way of phone calls, emails, or text messages. In addition, those healthcare providers who were registered through VAMS to be vaccinated and to schedule their appointments will also receive reminders via VAMS. It is also important to reiterate that the vaccines work with your immune system so that your body will be ready to help keep you from becoming sick if you're exposed to the virus. However, other steps like masks and physical distancing or what help reduce your chance of being exposed to the virus or infected or potentially spreading it to others. Vaccines are here and they are our light at the end of the tunnel. But until enough of us receive full vaccination, we must continue to wear masks, stay physically distanced from others, limit contact with those outside of our household, and stay home if we're sick and be tested. Thank you very much, and I think we'll now turn it over to questions.
Thank you, Dr. Traxler, for that update. The first two questions we've got: how long does the current appointment list extend out? And secondly, based on that length, what is your estimation of when Phase 1B guidance will be finalized and Phase 1B vaccinations would begin?
So I cannot tell you an average length for the appointment list extending out, because more and more appointments, as you've seen from the numbers, are being made at every site every day. And that is very specific to each vaccination provider in terms of how far out they are providing their vaccination schedules. We anticipate that more and more guidance, just like some did today, is going to continue to come out in the coming days and weeks, and that more and more populations will be invited to sign up to or register for an appointment for vaccination.
In regard to Phase 1B, we continue to receive lots of questions about who is in Phase 1B and subsequent phases and why individuals are in certain phases. Please help clarify again how it is determined who is in each phase of the vaccine rollout plan.
Certainly. So first is the CDC, the Centers for Disease Control and Prevention, has a committee called the Advisory Committee, think about it, Advisory Committee on Immunization Practices, ACIP for short, who the ACIP is comprised of multiple stakeholders from a variety of different domains, including not only medicine and science, but ethics and other groups. They come together and they have reviewed all of the data, both about the disease and the virus and the pandemic's statistics, but also about the vaccines. And they are the ones who initially come out with recommendations for the phases and who is in what phase. And then they vote after they've had a public comment period where anyone from the public, anywhere nationwide, can submit their input. Then they have further discussion and debate, and they vote on what groups or what criteria qualify for each phase. That is then guidance that is provided out nationwide to the states. In South Carolina, we then have the South Carolina COVID-19 Vaccine Advisory Committee, the VAC, and they take this guidance from ACIP and they apply it to the population of South Carolina. It's the VAC is made up of about 24 members who are representing really all aspects of our diverse population in South Carolina. And they take the guidance from the national level and apply it to be specific for South Carolina. And then they provide those recommendations to DHEC, who together with our state partners make a state decision.
Thank you, Dr. Traxler. If South Carolina residents 70 and older can begin scheduling their appointments this Wednesday, how soon could they actually begin receiving their shots?
So this is going to be dependent on each location, each vaccination provider's appointment availability, how many appointments they had available to begin with, how many are booked with healthcare workers from Phase 1A, and how many are going to be opening up in the coming weeks. But it is important to remember that we still have limited vaccine here at the beginning, but each week we are receiving more and more vaccine, and we're bringing more and more locations on board to help provide it. So if you are not successful at getting an appointment initially, just keep trying and you'll get your appointment.
Dr. Traxler, has DHEC been warned of any supply chain issues that might slow delivery of new doses?
I am not aware of any specific supply chain issue. However, that is something that we are aware could become a problem and have been monitoring from the beginning, and will continue to monitor both supply chain and production, and making sure that the manufacturing and production of the vaccines does not have any issues at any point along the way. Because that or supply chain issues are potentially very real things that could happen, but we are not aware of any specific current ones and are monitoring it along with our federal partners closely.
Thank you. Stephen, what is the latest data on vaccine waste and expired doses in our state?
Yeah, this is Stephen. So thanks for the question. So as of today, we are still seeing minimal doses that are being wasted, and this is based on the provider level that we get this information from. And again, just like we would handle any other storage handling requirements, we're in constant contact with providers if they do happen to have any kind of temperature concerns or questions. We are answering those on an individual basis to those providers. Thank you.
Dr. Traxler, after getting vaccinated, how safe is it to be around someone with COVID-19? And secondly, do you still have to wear a mask?
So the short answer for the second part is yes. And it is still not very safe to be around someone who has COVID-19, even if you are fully vaccinated, because these vaccines do a very good job, 94 to 95% effective, at preventing you from getting sick, preventing disease, preventing the virus from doing damage to your body if you get infected. We do not have data. We do not know about its ability to actually prevent you from getting infected, from getting if you're exposed, from getting the virus into you. And therefore, we don't know if you could continue to pass it on to other people, to continue to be contagious, even though you're fully vaccinated and may feel fine. So that is why, especially if you have to be around somebody with COVID-19, I would recommend it only be, absolutely as necessary, and that you both are wearing appropriate personal protective equipment, including masks for both of you. And it's why even wearing masks out and when we're interacting with the public as we get vaccinated is still important, because until we have enough of the population vaccinated to slow and then stop the spread of the virus at all in the communities, we could risk for getting it and passing it on to someone else, even if we're fully vaccinated.
The utilization rate of the Moderna vaccine is 19.7%. Understanding that it is a federal program, has DHEC received any explanation for the pace of the administration?
So the logistical details of this federal pharmacy long-term care program are determined by the federal government and the pharmacies in conjunction with the facilities. We do not have the schedule for the program in South Carolina, and the information and data that we have is we've also made available to you all. We have allocated already all of the doses that are needed for the entire program, which I believe is partially why we're seeing a lower utilization rate, is it does take a few weeks to vaccinate all of the facilities in South Carolina, but they already had all of the doses. So I expect that utilization rate to continue to increase, steadily as we go through and more facilities are offered vaccination.
If someone has had an allergic reaction to other vaccinations, should they be cautious about getting the COVID-19 vaccine?
Potentially. That is something, if they have had a severe allergic reaction, something like anaphylaxis, swelling, or hives, then I would recommend that you talk to your doctor who's familiar with your medical history, and together you and your doctor make an educated decision then about whether or when you should be vaccinated against COVID-19.
Thank you. VAMS has been a target of scrutiny lately. How close is DHEC to moving to another system, and what would that entail? Stephen?
Yeah, so right now, VAMS is an invitation only by email. And DHEC is currently looking at all available options for patients to be able to sign up to receive an invitation to the system. VAMS has already provided several updates, and they continue to provide, they will continue to do so. And they're currently working on a solution to help with this issue as far as patients being able to sign up to receive an invitation without having to get something directly to from a provider, instead having some sort of web portal. So they're currently working on that piece, and DHEC is also looking at all available options to be able to assist in the event that that doesn't come quick enough. But one solution that we feel is available, if what's being available online right now with the DHEC website, is the list of providers that have eligible clinics where individuals can contact beginning January the 13th to see what available appointments exist. Thanks.
And Dr. Traxler, how long after testing positive can a person receive the vaccine?
Sure. So as soon as a person who has tested positive is recovered from their illness and also has met the criteria for release from isolation, then they are eligible to be vaccinated. However, reinfection with the COVID-19 virus within that first 90 days after infection is rare. So people might want to consider waiting to be vaccinated until closer to the end of their 90 days to allow more at-risk people who do not have any antibodies to be vaccinated before them. But it is considered safe as soon as they are recovered and have met those criteria for release from isolation.
If a part-time South Carolina resident receives their first dose in South Carolina, then returns home to another state, could they receive the second dose in that other state, or do they have to receive both doses in the same state?
So we certainly encourage people to get their second dose at the same place they got their first dose for logistical reasons. And that includes, those logistical reasons include the fact that you have to get the same brand for that second dose as you did for the first. However, people could, in this situation, could receive their second dose in their home state if there was a vaccine provider in their home state who had the vaccine available and the correct one to give them. It's really important that those first and second doses have to be the same brand. So that is why we do recommend, to the extent possible, people go back to the same place for their second shot as they got their first.
Thank you, Dr. Traxler. And we did have a glitch when we were setting up our media telebriefing today. So many of our media partners were in another meeting. And Dr. Traxler, unfortunately, they missed your opening update. So if you wouldn't mind terribly, can you please re-give that opening update for our media partners?
Sure. Now?
Please.
Okay. So good afternoon again, everyone. And I did keep this opening remarks fairly brief today because we do have new information to provide, but we wanted to be able to answer as many questions as we could. We are continuing to make great strides in our vaccination efforts, both here in South Carolina and across the country. Each day, more and more vaccines are being administered into the arms of South Carolinians. More than 105,800 doses of COVID-19 vaccines have been administered in our state as of this morning. In efforts to further expedite the rate at which the vaccine becomes more widely available and utilized by South Carolinians today, DHEC and the governor's office announced that all South Carolinians who are age 70 years and older, regardless of their health status or any pre-existing conditions, can begin scheduling appointments this upcoming Wednesday on January 13th to receive their COVID-19 vaccine. And this is very important because those who are 70 and older have been the most devastated by the disease in our state. As noted in the news release today, the mortality rate from COVID-19 in South Carolina for those who are age 70 years and older is about 655 deaths per 100,000 individuals. For those people under the age of 70, there are approximately 37 deaths from COVID-19 per 100,000 individuals. That is a staggering comparison or contrast and illustrates why vaccinating those 70 and older is a really critical next step in our mission to save lives. More than 67% or 2/3 of COVID-19 deaths in South Carolina have been among persons aged 70 years or older. We estimate that there are roughly 627,800 South Carolinians who are age 70 and older. Although many of these residents, it is important to note, may have already received their vaccine either through the long-term care federal pharmacy partnership program that's underway, or for some of them, they may be frontline medical workers who are eligible for the vaccine. We also launched today a new online tool that provides a resource for locating a facility where those who are 70 years and older can make an appointment beginning Wednesday to receive their vaccine. Somebody mute.
Yeah, I'd like to remind everyone to please mute if you're not speaking. Thank you.
We are continuing to work to have more and more locations offering the vaccine, especially in those rural and underserved communities who may not have a hospital nearby. And mobile clinic will be a part of our plans to bring the vaccine to the people. We understand that some of our elderly populations aren't comfortable with navigating websites or using email. And so that's why anyone can call our care line, and our care line staff can assist by providing the correct contact information for scheduling an appointment. DHEC's care line number is 1-855-472-3432. It is also important to remember that both vaccines that are currently available require 2 shots, and it's important for everyone to receive both of those shots. Both the Pfizer, BioNTech, and the Moderna vaccines are 94 to 95% effective in preventing disease, but that's only after you receive both doses. Individuals will receive a vaccine card after receiving their first shot that reminds them when that second shot is due. Many providers are also issuing second dose reminders to individuals by way of phone calls, text messages, or emails. In addition, if you registered through VAMS for your appointment, VAMS will give you a reminder to schedule your appointment for your second dose and then to show up for your second dose. It is important to reiterate that the vaccines work with your immune system so that your body will be ready to help keep you from getting sick if you're exposed to and infected by the virus. However, other steps like masks and physical distancing are what help reduce your chances if you're exposed to actually being infected by the virus and of potentially spreading it to others. Vaccines are here and they are a light at the end of the tunnel, but until enough of us are vaccinated fully, we must continue to wear masks, stay physically distant from others, limit contact with people outside of our household, and stay home and get tested if we're sick with any symptoms. And that concludes the briefing, Christy. I will give it back to you for questions.
Thank you so much for doing that repeat, Dr. Traxler. We really appreciate it. Another question for you, Dr. Traxler. Is it proven that the Pfizer and Moderna vaccines can lead to herd immunity, considering it's unknown whether doses can prevent transmission? And then secondly, do they prevent asymptomatic infections?
So no, these vaccines do not prevent necessarily asymptomatic infections. We just don't have the data yet to know whether that occurs or not. And that is something that will be studied, is being studied now, and will continue to be studied in further trials. If everyone were to get vaccinated, you still could have herd immunity, because if there is nobody unvaccinated, then the virus really has nobody, no population to spread amongst. And so I would say that regardless of whether or not they can prevent transmission, if still, I think will affect, sorry, let me try that again. Whether or not the dose, these doses and these vaccines can prevent transmission will affect potentially what percentage of people we need to have fully vaccinated in order to reach herd immunity, but we still could reach it eventually, even if they don't prevent transmission. We just have to get a lot closer to 100%.
Who or what is setting South Carolina's eligibility rules or the COVID-19 vaccine logistics agenda? Who's in charge?
So the South Carolina COVID-19 Vaccine Advisory Committee takes the guidance, as I said before, from the CDC's Advisory Committee on Immunization Practices, ACIP, and applies it to South Carolina and provides their recommendations to DHEC. DHEC is working with its partners to finalize the eligibility criteria and logistics as statewide decisions.
As South Carolinians wait for the vaccine, how can the public help those in the hospital suffering with COVID-19 regarding plasma donations from those with antibodies?
So I would say that certainly donating convalescent plasma after you have been infected and recovered from COVID-19 is always recommended at this time. You know, all blood donations, I would strongly encourage our hospitals use blood donations of all the different components of it, including plasma and that convalescent plasma specifically for COVID-19. As we see more and more patients who are having severe disease and who are being hospitalized, and a number of them having to go to the ICU and being put on ventilators, there's more and more need for the few treatments that we do have for this disease, and one of those is convalescent plasma.
Thank you. Stephen, last week it was stated that approved doctors' offices would receive shipments of vaccines beginning this week. How are those offices being informed that shipments are on the way, and how much they are to receive?
Sure. So those offices there were offices that we brought on last week, for which we're calling onboarding week, and we do this each week. And those offices were notified by DHEC a week ago. So last Monday, they participated in a series of advanced onboarding trainings last week, and some town halls that we had, answering questions that they might have related to VAMS. And some of them also received their allocation amounts as early as this past Friday. And some of them actually received their doses today. So the Pfizer doses came today, and some of the Moderna doses came on Friday. And we'll continue this process of bringing on additional providers. So we're working this week to bring on additional providers to receive vaccines next week. And we'll continue that trend as long as vaccine doses are available. And we'll work to continue to bring on as many providers as we possibly can. Thank you.
Thank you, Stephen. Dr. Traxler, how will DHEC work with providers to ensure that all seniors who get the first dose receive their second dose of vaccine?
Sure. So just like with anyone who receives that first dose, we will be working with providers to communicate the importance of getting their second dose and the real need for it, as well as reminding them of when and how and where to get that second dose. And so I would say for the seniors, it may be some slightly different forms of communication than for younger populations. We will be using, across the spectrum, all different types of media, including the regular postal mail, postcards reminding folks, telephone calls, as I said, and then maybe for some of the younger folks, text messages or emails to get reminders.
And this will be our last question. When will children with underlying conditions be able to get vaccinated?
So the two vaccines, the Pfizer BioNTech and the Moderna that are currently available, do not have an emergency use authorization. They're not authorized for use in children under the age of 16 for Pfizer or 18 for Moderna. COVID-19 vaccines overall are still being studied in children, and we don't have an estimate yet for if or when they would be authorized for children, based on what the results look like of those studies.
Thank you, Dr. Traxler. In closing, I'd like to repeat the important scheduling information for your viewers or readers. That online tool again is found at scdhec.gov/vax, VAX locator. Individuals can also call DHEC's Care Line at 1-855-472-3432. We would ask that you remind Phase 1A individuals to schedule their shots now for that priority scheduling before Wednesday is opened up to those folks that are 70 and older. Again, we'll continue to hold these regular briefings at least twice a week. Our next one is more than likely will be Wednesday. Thank you for joining us again, and until next time, stay healthy.